Hey guys, it's Chrissy. Sorry, I'm trying to chase the light as the sun goes down. I wanted to keep video recording the discussions of preterm labor and the hospital stay, the bed rest, and the delivery since I'm kind of on that topic. So one of the things I mentioned in the other video is that I had recently started looking at the pregnancy videos, which I hadn't been able to look at for 2 years for fear that it would bring up a lot. And what's crazy is, I think it was 16 or 17 weeks, the update that I did, I talked all about my cervical length and how I was obsessed with it and how I was rubbed the wrong way by one of the technicians who said the wrong thing, and then I asked what the cervical length was, and she said, oh, the doctor will tell you, and then the doctor didn't ever end up seeing us. We were told that the doctor was watching the scan from the other room, and so I never got an answer to my cervical length question. And I can't help but dwell on that because I just wonder, if the doctors weren't catching this along the way, maybe we could have. And it's really hard when you suffer a loss like that to not blame yourself and to not constantly think about the what ifs and what could I have done differently and what could I have caught along the way to help prevent this from happening. And I'm trying to take the blame off of myself. It's been a very difficult thing because for a long time I have just felt like my body evicted my perfectly healthy babies and that they would have been fine if my body hadn't done that. But that's something I'm working through, trying to blame myself less. But it was just kind of freaky watching that one video, knowing that I was so obsessed with cervical length the entire pregnancy. It was something that I dwelled on, something I was constantly wanting to know and asking about, and yet this still happened. And that's so scary to think about because, again, you have no idea. And you never know. You never know when it's going to be you, unfortunately. So I was admitted to the hospital. I admitted myself. I showed up at this hospital. That's a very reliable maternity hospital, and was admitted right away. I was 3 centimeters dilated. They immediately started me on an IV drip for fluids because dehydration can often cause your contractions to increase and worsen. So they had me on IV fluids. They also put me on something called magnesium sulfate, which basically slows your major organs. And with that also slows down any contracting of your uterus. It also happens to be good for the baby's brain development. So it's something that, because of the effect that it has on your other organs, they can't put you on it long term, and they can't put you on it multiple times. It's basically once or twice. That's all they're willing to do. So I was put on magnesium, which makes you feel like crap. I also had my bed, my hospital bed. I requested that they put it in I can't remember exactly the term for it. I want to say it's reverse Transdellenberg or something crazy like that, where I literally had my head down and my feet up. So I was trying to keep those babies in the best way that I could. And unfortunately, it was the position of the bed along with the magnesium drip. But I started not being able to breathe and having chest pain. So they had to take me off the magnesium drip. And instead they put me on Procardia, which is supposed to slow contractions, calm your uterus, because they kept telling me I had an irritable uterus. And I wasn't fully having contractions consistently. I was having occasional contractions, but I had an irritable uterus. I was also told, get up, go to the bathroom, do what you need to do. But I was unwilling to do that. I wanted to know in my head and heart that I was doing everything I possibly could to keep those babies exactly where they were and keep them safe for as long as possible. So I resorted to using a bedpan, which is disgusting and terrible, especially for 9 days. But my wife is a trooper and changed my bedpan 1,000,000 times a day, because when you're pregnant, you have to pee 1,000,000 times a day. And when you have an IV drip when you're pregnant, you have to pee an excessive amount. So she was a good sport, getting up probably 10 times a night, if not more than that, to change my freaking bedpan. That's true love, ladies and gentlemen. That is true love. She was awesome during those 9 days. She still went to work. She went and cleaned at night and came back, and she kept shit going. Cared for the animals, and her. Now, mind you, the hospital I was in was an hour away from where we lived and where she worked. So she was driving that commute for initially 9 days and then for a subsequent 118 days, because that's how long Cayden was in the NICU. So she's pretty phenomenal. And so I stayed on Procardia for my 9 whole days. I stayed laying on my left side for as long as I could tolerate it, and then I would transition over to my right side, trying not to stay on my back. What else did I do? They took the IV out at one point. I want to say it was like day 5 of being on bed rest, and I immediately felt an increase in contractions. They told me they couldn't see that on the monitor. They told me that I was crazy, that it was all in my head. But the second they put that IV back in, which I had to demand and request and fight with a few nurses and doctors in order to get, I literally felt my uterus settle down. I was fortunate in the sense that I had 9 days of bed rest, so I had 9 days of Google searches to look up everything that I could possibly request and demand to help my babies. For people who are admitted and are past the point of no return and don't get that time to make those choices and requests in their medical care, I feel for them, because you're at the mercy of the doctors, and you have to trust that they, in their practice of medicine, are doing what's best for you and doing everything that they can do. And along the way, I made a lot of enemies. The doctor who was primarily treating me in the hospital hated me for probably the first 6 or 7 days, and then when we lost Carleigh, she was a completely different woman. She got in bed with me and cried and held me and told her about her loss and how sorry she was and how she really thought they were both going to be fine. But she hated me for a while because I called her from my hospital bed at 3 a.m. A couple times, actually, for insane requests that I was told wouldn't be feasible, but they did it anyway because they had to. Yeah. I'm filming. Do you want to come in? No. Do you want to be a part of this? I'm sure I'm missing a million things. It's about bed rest.
What part are you on?
Talking about how Sophagy probably hated me for the first 6 days because I was calling her at 3 a.m. and demanding things she didn't think I should have.
Yeah.
Yeah.
Oh well.
No? Nothing to add to that?
No, she probably did hate you.
She did hate me. I said she hated me until Carleigh died, and then she was a different person and climbed in bed with me and cried.
Yeah.
Yeah.
Well, you're the
Which
reason
means
why
everything.
You stayed there so long, so.
Yes, exactly. We are. We are the reason.
No, I said you're the reason.
Oh, no, we're the reason. You have to be your own best advocate as best you can, and like I said, I feel for the people who are in the situation where they're past that point and they can't take the time to do the research to figure out what's going to help and pull out all the stops. The high-risk doctor, coincidentally, that we are seeing now for this pregnancy, she's like the best in her field. Everyone will tell you that, but she has no bedside manner. And we absolutely despised her when I was on bed rest at the hospital because she came in and she basically said, nope, we're not doing a cerclage. We don't do them for twins. They don't work. No, we're not putting you on progesterone because it's not going to help at this point. You're too far gone. If these babies come, they're not going to survive. When I told her I wouldn't get out of bed, that I was using the bedpan, she told me I was, what did she call me? Delusional? Was I delusional? Neurotic. Could have been neurotic. This is why I need Chris. I don't remember. But she had nothing nice to say about me. She kind of thought that it was ridiculous, that wouldn't make a difference at all as far as whether I stayed pregnant or delivered. But we now have her because we chose to go to her because we were told she's very redemptive in situations of loss and that she's always trying to kind of make up for the loss that you had in the past with her. And that is so true. She's been amazing to us so far with this baby, which, by the way, it's a singleton pregnancy. I will probably do a whole other video about this, but I'm 21 weeks today. Go figure. So imagine, if you can, please try to imagine going into preterm labor at 22 weeks losing your daughter at 23 weeks, 3 days, day after they were born, and then now being 1 week away from going into preterm labor with your next child. It's completely and utterly terrifying. I'm getting that like teeth chattery, shaky, cold feeling that I was describing in the last video. It's like my go-to nervous reaction now, which I never had in the past, but I literally, like, my teeth clench up and chatter and I get freezing and shaky, and that's grief, people. That's what trauma does. But yeah, these next few weeks are going to be some of the hardest weeks of this pregnancy, no doubt. I just hope that I stay pregnant for the next few weeks. I can't even go there. I can't go there right now. But that's a little bit of insight into my 9-day bed rest experience. There's so much I'm leaving out. I'm going to have Chris watch this and then tell me what I'm forgetting, tell me what I missed, and I can add it in later. I'm sorry, this is such a mess. I'm so bad at this YouTube thing. The editing, I have no idea what I'm doing. My crappy phone sucks. My iPad's nearly dead. Our laptop doesn't even work. So please bear with me. I'm trying so hard. One day I'll figure this out. One day we will buy a Mac and life will be great and easy and our videos will be flawless. But for now, they're going to freaking suck. So I'm sorry about that. But from all the comments you've given so far, I don't think you really care. You guys watch us anyway, so thanks for that. We appreciate it. I'll touch base with Chris, see what I'm missing, and try to tack it on to this video. If not, I'll cover it in the next one. And I imagine the next video will be all about the scariest day of our lives, which was the day that they were born. And that was the most terrifying day. The next day, the day we lost Carleigh, is the most devastating day. So I know it probably sounds terrible to describe your child's birthday as the most terrifying day of your life, but it was, and it is. So, all right, guys. Aren't we the uplifting, positive, happy-go-lucky, cheery channel? But you guys, I feel like, are invested in our story, which means a lot to us, and hopefully you keep watching. Thanks.